us and also I'm conscious there's stuff after us, and also I've got a lot to kind of throw at you. So I'll make a start. So hi everyone, welcome to this CALC Day 2 talk on public libraries and homelessness. My name's Kavan, and I'm really happy to welcome you here today. I hope you'll find this an interesting session. I hope you'll get something out of it. So as I said, the session is public libraries and homelessness, a national survey. So if that wasn't what you were expecting, you may be in the wrong room, but you should stay because I think you'll enjoy it anyway. So the format of this session will be relatively straightforward. I'll begin by giving you a really brief introduction, outlining a bit of background about myself and the thinking behind this session. And after that, the session proper will be in two halves. The first will explore homelessness in libraries as it stands today, covering topics like statistical levels of homelessness in the UK, staff attitudes to homelessness, users in library literature and in other material, the informational needs of homeless library users, as well as some contentious kind of difficult issues like odour, for example, or sleeping. I'll have some discussion on all those things. I know that's a lot of stuff, so it'll be as much as I can fit in. And I'll try to give you my idea of my thinking on those topics as well as a general state of the field. In the second part, we're going to start with a Slido questionnaire. It's actually a Mentimeter. Now, I was going to make that a slide, but actually I've just put it in the chat, so you can actually click on that and fill that in just now, and we'll hopefully have some time at the end to just take a look at the results. It's only 2 questions. I won't use it for anything. It's just for our interest today. And then I'll spend the most of the time talking about the results of a nationwide survey I conducted for my book, Public Libraries and Homelessness, a Practical Guide, which was published by Facet, which is a Sillet publisher, last month now. So I did a nationwide survey to answer a few research questions. These are them on the screen now. How do library staff across the UK perceive homeless users of public libraries? Can staff identify particular challenges faced by homeless users in their services? And how can public libraries across the UK better help homeless users address those challenges in the future? So results from this survey cover a lot of different themes: prejudice, library policy, library spaces, funding, cooperation with external agencies, all sorts of things. And by the end of the session, I'm hoping you'll leave with a better understanding of one of the most pressing topics, in my opinion, facing public libraries today. And I'll also try and leave 10 minutes for questions at the end. That's the plan anyway. So before I begin properly, here's the definition of homelessness that I'm going to be working with for the duration of today's events. So a person is homeless if he or she or they have no accommodation in the UK or elsewhere. A person is also homeless if they have accommodation but cannot reasonably occupy it. For example, if there's a threat of violence, that comes up for women a lot, that they're fleeing domestic violence and end up homeless. A person is potentially homeless if it's likely that he or she or they will become homeless within 2 months, and a person is intentionally homeless if he or she deliberately did or failed to do anything which led to the loss of accommodation. Now, that's the Scottish Government definition. I'm going to talk a little bit about this, but each of the 4 nations of the UK define homelessness a bit differently and count it a bit differently. I think the Scottish Government definition is pretty good. I think it's relatively clear. But the English, Welsh, and Northern Irish definitions are roughly the same. There's the differences are a matter of degree rather than anything significant. I'm also going to be using the word homeless throughout as well. So you might have seen some discussion recently. I'm never sure how much discussion about this topic people see, because obviously I see a lot of it, and then it kind of takes over my life, and then I'm not sure whether I'm just a weird one. But you may have seen some discussion recently about the use of the term unhoused instead. In the UK, we tend to use the term homeless. That tends to be what's preferred by homeless people. I don't personally love unhoused because, as we saw in the definition, as we can see in the definition on the screen, you can be housed and be homeless. It's just that if you are, for example, sofa surfing, you're still homeless, although you may be housed. So I don't love it, but whatever one you want to go with is fine. I went with homeless just because that's what's generally used. Okay, so part 1, homelessness statistics in the UK. I'm going to start by just laying out some stats about homelessness in the UK in general, and then I'm going to look at one city in particular. I think these facts can be quite shocking when they're kind of starkly put on the screen like that. So these statistics are taken from the four devolved governments of the UK, or the three devolved governments in Westminster. So they aren't directly comparable because they all collect data in different ways and over different time periods. However, I think there's enough information there to give you an idea, wherever you are in the UK right now and you're listening to this, as to the scale of the problem. So all the stats are from about a year to 18 months ago. All the nations released these stats at different times, so that was the best complete year that I could put together for today, complete kind of set. As we can see, each of the nations have seen an increase year on year in the number of people presented as homeless. That's a trend that we've seen throughout the last 5 to 10 years. Politicians undoubtedly would get a lot of pleasure and mileage out of arguing over whose percentage is better. Ours is 8, ours is 4, ours is 10. But for those of us who have to live in the societies that are created by those politicians, I think we need to remember that each one of these numbers on the screen, so 40,000 in Scotland, 13,000 in Wales and Northern Ireland, 358,000 in England, represent a human being who's been left without a place to call their own, without their own home. And there can be lots of reasons why people end up in that situation, and we don't have time to go into them today. But the most common reasons are evictions, so being asked to leave their home, and non-violent relationship breakdown. So evictions are about 38%, non-violent relationship breakdown is about 13%, and violent relationship breakdown, which is a kind of mealy mouse term for domestic violence, is between 7 and 9%, depending on the country. So we're looking at hundreds of thousands of people across the UK. I next want to just show you these numbers. These are the numbers of children, the most vulnerable people in our society, I think, who were homeless during this period. So just a little bit about the stats here. For Scotland and Northern Ireland, those numbers are individual children. So 15,000, 7,000, that's individual children. For England and Wales, they represent households with children. So it should be noted that in England and Wales, the number is higher because households may have multiple children. It's hard to say how much higher, but it will be a bit higher. Again, each of those numbers is a human being who's a child who's left without a home. And I want to end with this really cheery statistical tour with a look at one particular city. I've chosen Glasgow just because I live there. But I think it's important to drill down in some of these numbers in a more local sense. I know this may not be relevant to those of you who don't spend time here, but actually Glasgow's a pretty representative city across the UK in terms of homelessness. So as you can see, the number of homeless people for Glasgow hovers about the 3,000, 4,000 mark. The most recent stats are 3,727 homeless people in the city. And so when we're thinking about the amount of homeless people that are in individual cities, we need to think about the fact that this is what public libraries are working with, right? So in Glasgow right now, there's 3,700 homeless people, give or take. A lot of them are based in the city centre due to locations of shelters and so on. And for a lot of the day, they're outside in quite a cold country without access for anywhere to be out of the weather and have something to do, except, of course, the public library. And for many people, the public library offers this avenue to escape an identity which is subject to a great deal of stigma. Now, you can be homeless for lots of different reasons, and lots of different people become homeless. The demographics for homelessness essentially mirrors the demographics of the UK as a whole. So people of all races, genders, ages become homeless. There isn't anything about being homeless which indicates anything about a person's identity or a person's being in any meaningful way, except for the fact of their lack of a home. But that identity still brings with it a lot of stigma. And that brings us to the next part of our discussion, which is probably one of the larger parts, staff attitudes towards homeless users in public libraries. So you have this background in the stats that you're going to need to understand what we're going to talk about. And what I'm now going to talk about is some of the research that had already been done on homelessness in libraries, which really informed my thinking going forward when I was writing my own studies. You'll have seen so far that I like to divide things into sections, so I'm going to divide this section into 3 sections. So first, I'm going to look at staff attitudes towards homeless users and how they use libraries from the perspective of people working in how homeless users use libraries from the perspective of staff working in them. Second, I'll examine some research done in what homeless users actually need from libraries as opposed to the perceptions. And third, I'll talk briefly about a couple of the more contentious issues which arise a lot in library literature and which I know people tend to have questions about and I think it's worth dealing with head on. There's no point in beating about the bush here. As we start to look about how library professionals write about homeless users, it can be tricky. It's not always great. And those of us working in public libraries might know that quite well. The fact is, we're working with increasingly small budgets and with very diverse communities with very diverse needs, not just homeless people, all of our communities. Hitting and meeting all those needs as we're expected to, and the expectations are high, is very difficult. And especially so when we're talking about meeting the needs of a group like homeless people who are both vulnerable and the subject of discrimination from others. The literature on this subject recognises the fact that staff are often torn between multiple roles when serving homeless patrons, some of which are beyond the scope of their jobs and their training. And that's from Anderson and colleagues in 2012. And those of us who have been in the role for a long time and seen the gradual collapse of social security in our communities might feel the same way, might feel that the author Wong is correct when he says that library workers want to accommodate the homeless, but feel that services for part of the homeless are not part of their job. They're not paid for it, right? What one researcher found, and I think this is something that might resonate with you guys, is that most librarians in this situation are sympathetic but frustrated by low budgets, lack of support, and lack of training. So these are the reasonable opinions, and I think there's a lot to be discussed there. But not all the opinions we come across are so reasonable. There's a couple of really famous essays, which I'm going to put up on the screen in a second, which take what I would describe as quite a harsh perspective. And I draw attention to these because they say things that you've probably heard from colleagues or from other people outside the libraries, and I think it's important to address what they're saying. So these are two particular articles from the early 2000s, one by Bullard, I think it's Sandra Bullard, and the other by Blaise Cronin. Now, you might think these are quite old, and they are, but the attitudes described were really popular at the time. The author Genner noted that letters of response published in the subsequent library journal issues to Cronin's article supported him by a ratio of 3-1. And I do believe that the attitudes persist in one way or another in modern librarianship. These are the quotes I'm going to show you. These are things that I do hear from people. And it's still a live issue now. So Mars says that the biggest barrier for homeless patrons, in his opinion, lies with the attitudes of library staff. And Dowdell and Liu did a survey of librarians in America, and some respondents to that said that their colleagues were not always pleased to deal with homeless patrons. And Behrman stated outright that most libraries are still unwilling to give up institutional barriers to access for the poor and for the homeless. So looking at what these pieces say, Cronin's piece is quite blunt, argues that a library is not a refuge for the homeless, and that we're getting to the point. This is one of my favorite quotes. Sorry, the next one's actually one of my favorite quotes. This one's. We're getting to the point where a disruptive minority is effectively preventing the majority of bona fide library patrons from exercising their rights. So these opinions are particularly candid, but they're not unique. In the same year, Bullard expressed concerns that today's libraries have become a haven for the homeless, the young, the substance abuser, the sexual deviant, the elderly, the criminal-minded, and the mentally disturbed, which is quite a cavalcade. And the equation of homeless users with sexual deviance suggests a particularly low opinion of these users. You have to wonder what the elderly and the young did to deserve to be lumped in with this particular group. But there you are. I want to be pretty clear here that the idea that homeless users are a disruptive minority is something of a myth. I'm going to guarantee you that you're not aware of most of the homeless users in your library. So you will be aware of some, I'm sure you are, but they're the exception rather than the rule. Many homeless individuals, particularly women, actually put a great deal of effort into not appearing homeless and to keeping themselves to themselves as much as possible. In fact, the way that the average homeless user makes use of the library is, and I'll discuss this in a moment, kind of the same as everyone else does. Regardless of whatever we think, I have to go with Herzberger on this and say that if we're going to categorize an entire class of people as problem patrons, that really can't be called anything other than discrimination. We need to judge people by their actions and not their identities. So, how do you make the library a welcoming place for everyone when not all library users or even staff members feel comfortable around signs of homelessness? This is a difficult question, right? This is something that's quite hard to deal with. And Roman asked this question, I think, coming from a very good place. People don't feel comfortable around signs of homelessness. And because they don't feel comfortable, that discomfort can then transfer onto other users of the library and indeed the homeless users themselves. But I think one of the things that can help with this is consideration of what the needs of homeless users actually are. So, an important part of answering that question is looking at what they need. So, the fact is that homeless people often need the same things as we all do, right? They're human beings first and foremost. So Wong says, like other regular users, homeless people have both general and specific needs when they visit the libraries. Some of the needs are information related and some are not. And I think that applies to all of us. And when their information needs are considered, they're generally found to be kind of the same as any other user. So Province found in 2021 that the two most commonly reported needs by all patrons, regardless of housing status, were employment and financial needs, closely followed by computer access and transportation. So the idea that homeless needs are the same as those of other users is reflected in other studies. Kelleher discovered the apparently shocking news that internet access seems to be very important to many homeless people and suggested that they simply enjoy the ease of accessing information and entertainment online. I mean, yeah, why not? And Muggleton, working in Glasgow, argued that contrary to the beliefs of Cronin and others like him, homeless people tend to use public libraries in much the same way as anyone else. With all that said, you might wonder why it's worth having a talk like this at all. Why are we talking about homeless users as a separate library user group when I'm also saying that they use libraries in the same way as everyone else? And I think there's a couple of quite short answers to that. Homeless people should still be seen as a special user group because, as Wong says, their information needs are often underserved and their rights to access libraries are often not clearly defined. So although their needs are the same, are they getting to meet those needs as much as the rest of us are? Additionally, when those rights are removed, so those rights of access, when those are removed, homeless users are at a disadvantage dealing with what we all know are opaque complaint systems of local councils and public libraries, and with people who are going to judge them for the way they look, not for what has actually happened. We might not like it, but the fact is that many of those in charge of public libraries and of any service really would react very differently to the same complaint coming from a homeless man in old clothes, maybe smelling bad, than we would from a well-spoken man in a neat suit. And that's part of the prejudice that comes across. So I'm now going to finish off this first half by talking very briefly about two issues which come up a lot in discussions about homeless users. They're contentious issues and they're delicate ones, but it's important that we discuss them properly and openly, partly because they are so contentious and delicate. The first is odor, right? This is an issue frequently discussed by librarians. It's discussed a lot in the literature. It's discussed in my anecdotal experience working in public libraries. It just comes up a lot, and kind of understandably so. In 2023, Hancock et al. Found that some librarians classify foul body odor as being a disturbance and ground for asking someone to leave. In 2017, Giesler said that the most common concern for library staff around welcoming homeless users to the library was foul odors. The American Library Association said outright that body odor was an enormous problem. And it's also noted in maybe a more measured and compassionate way, even by IFLA. So IFLA said that it was one of the most, I think, the second most common complaint put out about homeless users from the people they surveyed. So a lot of this is based around a concern that library users who smell offensive are problematic not only for employees but also for patrons who might decide not to come back. Right, so you go into a place that doesn't smell good, maybe you don't come back next time, and that's an understandable concern. So there's no doubt that odor is a matter of concern, but the question is this concern based only on the unpleasantness of the odor itself, or does it have more to do with the source of the odor? In short, are we trying to make the library free of unpleasant smells, or is the unpleasant smells only a concern when the source of those smells is an undesirable user for other reasons? For Herzberger, and for me as well, it seems likely that the latter is true. So she argues that inappropriate behavior is a legitimate reason for asking a user to leave the library, but that's a separate issue from the user's social status. So it's very easy to separate those two things out. It's nothing to do with social status if you're bothering other or annoying other library users, if you're swearing at staff, all that kind of thing. That's very simple. But when you look at older toddlers who can be smelly and loud and are not in the library reading anything, they're often asleep. Nobody advocates for them as a problem patron group unworthy of library services. She's been a bit facetious there, but I think the point is made. And users and staff who are overly perfumed, she notes, also can cause physical reactions in others. So the question needs to be asked then is whether a toddler in need of a nappy change, or a person of any age with a continence issue, or an individual wearing a scent so strong as to cause sneezing and discomfort in those nearby, would be asked to leave the library as quickly as a malodorous homeless person would. I think the answer is no, and I think our conclusion must be, therefore, that the problem of odour discussed in library literature is not always about smell. Sometimes it's also about prejudice. A lot of you have bristled at that last slide. I totally understand. I know that you have, because I've seen it in person many times. I've given versions of this talk. This is a much longer one, but I've given versions of this talk a lot of times over the last 3-4 years. I've given it to the NHS, to the Health and Social Care Partnership. I've given it at CILPS conference. And every time that particular comparison does draw looks. There's something about that comparison of bad smelling homeless people to the smell from toddlers or incontinent people that raises hackles. Common responses include things like you might have been thinking when I was saying it. That's different. It's an unfair comparison. They're not the same at all. But aren't they? You might say that homeless people, unlike toddlers, are adults, of course, and you'd be right, and are held to different standards, which is true. But so too are people of any age with incontinence. Adults with incontinence are held to different standards. You might argue instead that toddlers and people with incontinence can't be blamed for the smells they bring with them. It's not their fault. It's out with their control. I would argue that the same can be said of malodorous homeless people. It's a reasonable assumption to make that nobody has any particular desire to smell unpleasant, especially when, as I said, they're often trying to quietly go under the radar and make use of public services. The fact is that shower facilities, including facilities available for homeless people, are very limited and are not of good quality. What follows that then is that if a person does smell unpleasant, it must be for one of two reasons. I think most of the time it's for a reason outside their control. But of course, there do exist people who are perverse enough that they do want to smell bad, right? But I would argue that if someone's in that position, you need to start considering whether they actually have a mental illness as well. And that brings us right back to the idea of the odour being outside your control. The short truth is this: if every individual, old and young, who's responsible for an odour disliked by another user is not removed from the library, then the odour wasn't the problem. So the second of these two common problems library staff have is sleeping. That's a big one. This is far and away the most common topic of discussion in the area. It dwarfs odour, actually. In fact, an IFWA study of homelessness in 2017, they found that of the libraries they surveyed, more than 50% had policies specifically related to sleeping. And in fact, it was the number one prohibited behaviour in libraries. That is to say, it was more likely to be prohibited than abusing staff or swearing at staff. The concern is actually common among library patrons too. So this is something that comes up in the odd survey that's been done on library patrons' opinions of other library users being homeless. So Garner last year, 2025, in Australia, found that the attitude of the respondents that she interviewed towards people sleeping in the library was clearly in favour of this not being permitted. So 50% of the users that she interviewed strongly disagreed with the statement that people should be allowed to sleep in the library, with one respondent stating outright that libraries are not for sleeping. And I think the reason for the issues around sleeping are simple enough. Even when a person's not snoring and is sleeping quietly, not disturbing anyone else, there is a concern that comes up a lot of this phrase of libraries becoming a de facto day shelter. This particular anxiety comes up all the time, and it's usually coupled with a concern of some kind of mission creep in public libraries. So Cathcart states that acting as a de facto shelter isn't part of the library's explicit mission. Cronin argues that libraries are not shelter, and Johns in 2015 said that there are reasons for concern when libraries double as homeless shelters, while Ward in 2007 said that every other urban library is a de facto daytime shelter for the city's homeless, and that's not acceptable. I think we need to set aside the kind of nebulous and ill-defined concepts like the mission of public libraries. It's kind of meaningless, or at least it means something different to everyone else, which is to say meaningless. But setting that aside, I do get the concerns with it. And I do think that a lot of the concern comes from that idea from Cronin that homeless people are a disruptive minority that effectively are preventing the majority of bona fide library patrons from exercising their rights. In short, I think library staff don't want people sleeping in the library because they don't think it's an appropriate use of the space. That said, I think it's also important to note that the restriction of sleeping on public libraries, I think, could be seen as an extension of the general societal trend which restricts access of homeless individuals to public spaces. And I think we need to also consider the fact that with so many other spaces restricted, sleeping in the library might be some homeless people's only option. So Dorothy Sterling, who's a homeless individual in Chicago who was interviewed by Roman in 2014, she argued that homelessness is an exhausting lifestyle. Those who live in the street typically carry everything they own with them, and they're afraid to fall asleep for fear that someone may steal their belongings. Most of the homeless, she said, we walk all night. Your body just shuts down. Simply put, there's nowhere else safe for homeless people to sleep. Now, an argument can be made, and I think it can be made well, that this doesn't mean that sleeping should be allowed in the library. But I would ask this question: what is the actual harm? A silently sleeping individual is, like I've noted above, also inherently not disturbing anyone else. The other library users might not like it. It's unfortunate, but there are presumably lots of things that other library users don't like that they just kind of need to live in as part of being out in a society with other people. So it's not in and of itself reason to legislate against it. Now there are safety concerns, obviously, and I think they can be allayed simply by briefly waking a sleeping individual and asking if they're okay before leaving them to rest. And I think it should also be noted that when homeless people have no private space to perform what Amster calls uncivil functions of life, so using the toilet, sleeping, the things that you're not supposed to do in public, them having no place to do that is a conscious choice made by successive governments in this country. And those governments are run by the political parties who are responsible for local council public libraries. So it does seem reasonable in some ways that state services like public libraries should be part of the solution and mitigation of that harm. What all of I've just said boils down to, not just the stuff about orders of sleeping, but all of it, is that striking a balance between making the destitute feel welcome and the general library public and staff feel comfortable is tricky. That is my conclusion to the first half. That can seem like not much of a conclusion, but I think it's what we're going to need to sit with because I don't have hours and hours, much as I would love to go into it more. So let's move on. The moment you've all been waiting for. So through late 2024, as part of that book that's on the screen there, Public Libraries and Homelessness, I sent out a survey throughout the whole of the UK with a view to analysing and discussing the results in that book. So it was a Google Forms questionnaire, consisted of 13 questions. It was distributed throughout the UK in a variety of channels, including including a dedicated webpage on the CILP site, through social media channels of CILP Ireland, CILPs, through the Scottish Library and Information Council, through Arts England as well, through the newsletters of Public Libraries News, through Library Connected, as well as I got in direct contact with 30 of the biggest councils in the UK. It was also distributed by the CILP Cymru Wales Committee and the CILP Ireland. So the survey was anonymous, but respondents were given the opportunity to give their email address separately to their responses for a chance to win one of two available £15 Amazon vouchers, which were distributed to two randomly chosen respondents in early April last year. So all in all, we got 151 members of staff across the UK. So the anonymous survey started with a really short initial question, asking respondents to tell us what they considered their role to be in terms of library management. allowing an option for other and a space for respondents to self-describe if they prefer, because there's so many hybrid roles in modern libraries. We all have these different job titles and so on that sometimes it can be hard to describe. Questions 2 to 8 were closed Likert scale questions. So that is to say there was a scale of 1 to 5, usually, very, very strongly disagree, neutral, agree, strongly agree, and to pick one of the answers. And all those questions were about the library service and any homeless people that use it. Questions 9 to 12 were open-ended questions, inviting participants to talk a bit more at length. And although those questions necessitated a lot of really careful and time-consuming coding and thematic analysis, the detail and thoughtfulness of the responses we got were really, really helpful in answering the research questions. So there's a few limitations that I'll talk about before we go on. It's not exhaustive, but these are, I think, the most important ones to bear in mind. The first was that the pool of respondents was limited to library staff working in the UK only. If the study was to be repeated, it would be amazing to extend the sample size significantly to collect as broad a range of results as possible, although that would bring other limitations in terms of different definitions of homelessness and so on. Additionally, and unfortunately, no homeless people were consulted. The initial plan, the initial pitch to Facet and to CALC was that I would do so. But when they asked that I expand the survey beyond Scotland, which was my initial idea, effectively surveying homeless individuals became really challenging due to digital divide, lack of access to material, to computers to answer a digital survey, and also financial constraints in that I just couldn't travel throughout the UK to do it. Homelessness was deliberately not defined at the start of the survey. And this is because different local authorities and the constituent nations of the UK, as I said, define the term differently, and it seemed important to allow staff to understand it as it was understood within their own library service. Time constraints were also an issue. I was on a deadline, so it had to be disseminated, completed, coded, analysed at a really tight time frame. Those time frames are just inherent to traditional publishing, so that limited its length and the amount of time that was made available to complete it. So I think there was about 6 weeks to complete it. With all that said, I think we're ready to look at the results. So I'm going to go through each of the questions one by one. I'll give a little bit of discussion for each. It really is going to be a very quick summary of the discussions. We're about half an hour in now, so this will take me probably about 15-20 minutes more. Obviously, all of this material is covered in much more detail in the book itself. So, looking at the first question, this asks how respondents would categorize their role on this line between management and non-management. And what we found was that the balance of management to non-management and respondents was skewed slightly in favour of management, with management making up 55%, so 83 of the respondents, and non-management 40%, 61 of the respondents. The remaining just under 5% there, that was made up of various other self-described roles, as I said, a lot of which reflected the kind of hybrid job descriptions which we're getting very used to in libraries now. So they were included but not limited to. One person said, I'm not a manager, but I have some management responsibilities. I think that's something we all recognise. Someone said they're a library supervisor with one job and many hats. I'm sure we all recognise that as well. Another one was planning, organising, promoting and supervising library events, programmes, adult education and so on. So a few different ways to describe their own work. The fact that management was slightly overrepresented in this study, despite the fact that in most libraries, frontline staff will outnumber those managing the service, I think this has a few different reasons. The first is the way the survey was disseminated. So it was largely through these professional bodies like CILIPS and SLIC and so on. And also the possibility of managers having a bit more desk time to complete such things. So I know when I was a library assistant myself, the chance of having the time to sit and fill in a survey on work time was actually quite difficult. And I think there's also the small possibility that management of libraries, particularly because they may be more likely to have it as a profession, might have more of a vested interest in presenting the service they run and how it works. That's a possibility, I think. So moving on to question 2. This asked respondents to reflect on their opinion about homeless individuals using the library on the scale from very positive to very negative. So 5 things in that scale. The results revealed that a slight majority of respondents, so 58% or 88, had either a positive or very positive opinion of homeless individuals making use of the library. However, they also reveal that the most given answer after positive is neutral. So it's 34%, 51 of the respondents. What I think this number, the neutral number, likely reflects is the fact that the homeless are not a homogenous group, even though they're often treated that way. And so it's quite reasonable for library staff to indicate that the question is difficult to answer, is a difficult question, seeing as how they might feel might depend on the individual homeless person in question. I think it's very reasonable. The 7.9% of respondents who selected either negative or very negative, which was about 12 of them, is by no means statistically insignificant. It amounts to almost 1 in 10 after all. But it does reveal that a huge majority of library staff at least profess not to have a specific problem with homeless individuals using the library, which I think is great. While question 2 asked staff how they felt about homeless individuals using the public library, question 3 instead asked about how staff felt homeless individuals impacted other library users. So I asked them to indicate how much they agreed with that statement in the screen there. I think that homeless users generally have a positive effect on other library users, and they could rate that strongly agree, neutral, disagree, or strongly disagree. That's an important question to ask, I think, because often in the literature we see that restrictions and biases against homeless users are defended on the basis that the homeless users make other library users uncomfortable in some way. And as can be seen, the dominant response of those who surveyed on this question was neutrality, right? So about half, 49% of them selected that option. It seems to me that this should be the default option when answering this question relating to any group of library users. If, for example, the question asked whether male or female or homosexual or black or trans users or users over the age of 40 generally had a positive effect on other library users, the only reasonable answer would be one of neutrality. I mean, what's to be said? They may have a positive effect, they may not. Libraries are community spaces, but also a lot of the pursuits within them, computers, reading, studying, even warming up and with some heat, are by their nature kind of solitary. So we'd expect a lot of users, homeless or otherwise, to have neither a positive nor a negative effect on their fellow users. However, 41%, 63 in total, only 7% less than the neutral option, either disagree or strongly disagree that homeless library users generally have a positive effect. So we can assume that some of these respondents merely mean that the effect of homeless users on other library users is not necessarily negative, simply not positive, right? It could be a kind of neutrality. But when we examine those results, along with the examples we've given earlier in the talk and with the 49% neutral section, it seems more likely that a lot of the respondents feel that the effect of homeless users on others is, in fact, negative. Only a very small number of respondents, 9.3%, felt that homeless users did have a positive effect on other library users, with 7% saying they agreed and 2% that they strongly agreed, reflecting that respondents mostly think that homeless users have either a negative or no effect on other library users in the library. In truth, however, I think that is difficult to consider whether a user is having positive effects, and it's hard to see maybe what that might look like, aside from maybe general friendliness. As discussed earlier in this presentation, the ostensible universal application of library rules does not always mean that they're as equitable as they should be, especially at a time when the claims of homeless people to belong and their rights to participate are so often questioned publicly, and consequently they face these barriers to social participation and support. For these reasons, it's really interesting to me that 57% of the respondents of the survey said they don't agree that their library has policies which might disproportionately affect homeless library users. It's possible, of course, that all of those respondents come from library services which have no rules that would disproportionately affect homeless users, and it's impossible to check because it's anonymous. However, when you take that combined with the other answers, including the open question answers, that seems kind of vanishingly unlikely. I think what seems more likely is that most of the respondents who selected this option genuinely believe that their library service doesn't have any policies which disproportionately affect homeless individuals, and that they're maybe using the flawed logic that's reflected in that old aphorism from the 19th century, that the law in its majestic equality forbids the rich as well as the poor to sleep under bridges. There can be feeling amongst library staff, though, certainly not unique to them, that the best service can only be provided by treating everyone with blind equality. So insisting that everyone follow exactly the same rules, regardless of how those rules happen to affect individuals. But I think this is to miss the value of instead aiming for equity, by which I mean equal and fair, in light of similarities and differences. And we need to remember, therefore, that homeless library users are a vulnerable group and their needs should be considered accordingly. And that them being treated equitably might not always mean being treated equally. Question 5 asked to what extent the respondent agreed with the statement that the library does enough to help homeless users make use of its services. And it produced an interesting set of results. So half of the respondents said they either agree or strongly agree that their library does enough to help homeless users make use of the service, which I think is great. And the remaining half is split pretty evenly, just about, between those who disagree or strongly disagree and those who are neutral on the question. With those who agree or strongly agree, I think that will be split in some way between those who think their library does loads for homeless users and those who think, and this was reflected at the time in some of the answers to the open question, that their library, if anything, does a bit too much for homeless users. I do think we need to consider the possibility that some of the respondents agree with Cronin's that libraries aren't a refuge for the homeless, and maybe that we're getting to the point about this disruptive minority prevent other library users from exercising their rights. That may be what they mean by the idea that they do enough, that they shouldn't do more. That said, that a quarter of respondents thought that their library did not do enough to help homeless users make use of its services is also significant. This was split into 30 people who said that they disagreed and 7 who said that they strongly disagreed. As can be seen, then, the disagree option was actually the third most popular option, so I made 20%, and came in significantly ahead of strongly agree. What those numbers reflect is that a large number of the respondents thought that their library could be doing more to help homeless users make use of the services, and also potentially that homeless users were experiencing some, maybe inadvertent, discrimination in their library service. This question follows on quite neatly from question 5, but differs in some key respects. So question 5 was asking specifically whether homeless users could access the services. This asked respondents to reflect on whether their library is welcoming enough to homeless users, whether it could be more so. This speaks specifically to staff treatment of homeless users in the library. The results of this question reveal that 45% of respondents either agreed or strongly agreed that the library should do more in future to welcome homeless users. And as can be seen in the graph, the split of those answers was significantly weighted towards agree. So 48 of those respondents said that, compared to 20 who said they strongly agree. However, it still suggests that a significant number of respondents felt that their library was not welcoming enough. So almost half felt their library was not welcoming enough. That said, the most popular single answer in this question was that of neutrality, with 32.5% of respondents selecting it. So that was more popular even than agree, although only by one person. This means that about a third of the respondents felt that they were not sure whether the library needed to do more in future to be welcoming. And I think those answers fall between two categories. The first may be that those responding felt that while the library wasn't as welcome as it could be, they weren't sure whether more was appropriate, given potential feelings from staff and users that homeless users aren't a desirable group. And the second may be people who are unsure as to how welcoming their library was at the moment, and so felt unable to gauge. Now, looking at question 7, although the pandemic can sometimes feel very far away now, its effects are still felt in libraries quite keenly, and the closing of public libraries had quite a deleterious effect on homeless library users. This was especially the case because even upon reopening, there were significant restrictions on dwell time. Now, I've argued elsewhere that dwell time, like soft furnishings, is a really important service offered by libraries. And I think my opinion is it should be reinstituted in a safe, socially distanced way, along with the rest of the services upon reopening. I argued that in 2021 in the big issue. But at any rate, for those reasons, it was important to ask whether the library staff surveyed thought that the COVID-19 pandemic made making use of library service more difficult for homeless individuals. And results of the survey showed that 60% of the respondents either agreed or strongly agreed that this was the case, more than the other two put together. This result can be explained in two ways. First, many of the respondents may have noticed that homeless people were particularly affected by the pandemic closures. Not only were they not able to access the building like everyone else, but they also likely had less access to the kind of mild revolution digital library material that occurred during that time. Now, it should also be noted, though, that some of the respondents might have been indicating that homeless library users had less access to the library during the pandemic because everyone did. which could be fair enough. In some ways, this final close-ended question is the key to the whole survey, and the results are revealing. So the question asked how much the respondent agreed with the statement, I think that homeless users receive the same treatment as any other user in my library. And really, that's what it all comes down to. What we find is that the respondents, 63% of the respondents either agreed or strongly agreed that homeless libraries receive the same treatment as everyone else. That's more than 2/3 of the library staff surveyed, so they feel that their library treats everyone there the same. And that's a good thing. And if true, it would indicate that the problems faced by homeless individuals are maybe not as significant as we supposed. But we need to consider other possibilities as well. It's possible that some of those answers are a result of unconscious bias. It's possible that they haven't considered the potential impact of policies such as those around sleeping in a library, which ostensibly apply to everyone, but are significantly more likely to affect homeless users than those who are not. It seems likely that the proportion of answers in this category must come from across a range of those described opinions, including that some libraries, as is evidenced by some of the open-ended questions answers later on, genuinely do strive to treat everyone the same as far as possible. Some really, really do. Okay, now we're going to have a very brief look at the open-ended questions. Don't worry, we're almost done. So these naturally produce a wider range of responses. You can see the questions themselves on the screen there. I'm not going to read them out because we don't have time. I'm just going to discuss each of the themes which emerged from the answers. The themes which arose from the coding were prejudice, policy, space, funding, and cooperation. So prejudice as a concept isn't something we need to spend a huge amount of time on. It's mostly what I've discussed today, right? The interesting thing which arose from remarks on this topic, though, as you can see, is that although this theme identified by a few respondents, only 3, including one who asked, why do you think the library should be a place for bathing, sleeping, and doing drugs, exhibited any inadvertent or unconscious prejudice themselves. Rather, the majority of the responses along this theme were expressing concern that other members of the staff or other library users were prejudiced towards homeless users and a real worry about their homeless users. And I think these results demonstrate a real empathy and kindness from the respondents and worry that their libraries are not always as welcoming as they could be. So on the screen there, we have someone saying, I think some of the staff need to be more welcoming. Another one saying some of the patrons make homeless people feel unwelcome. Another saying that they feel the way that staff members talk about homeless people is concerning. Now, we've already discussed the issue of library policies about odor and sleeping and so on, and the idea of policies and how they can be improved comes up a lot in studies in the topic. And a lot of the answers given to me by respondents can be grouped around that broad theme, especially because question 9 specifically asked about what changes to policy, if any, the respondents thought might make homeless library users make better use of the service. It's a broad topic, so the answers relating to it are quite diverse, but I think they can be divided into 3 subgroups. So the first is remarks regarding circulation policies, and we see that in that first one there. The second is policies around sleeping, which we see in the middle there, that came up a lot. And the third is relating to antisocial behaviour, and we see that in that third response there. I have an example of each of them on the screen. We haven't discussed circulation policies much today, but they have a lot of relevance. I don't think we have time to discuss it, but it is interesting. But I think it is important to note that some staff express feeling unsafe in their libraries and their workplaces, and this isn't acceptable. Now, the distinction has to be drawn between feeling unsafe and being unsafe. Right? These are 2 different things. But even if it's just feeling unsafe, libraries need to work hard to make sure that that feeling is allayed, that those fears are allayed, and staff are made to feel comfortable. In my opinion, I think perceived unsafeness, as opposed to real unsafeness, which can be dealt with, is often the result of ignorance, stereotypes, and a fear of the other, which can be helped by training. Looking now at space, this is again a topic we haven't had much time to speak about today, but came up a lot. Fundamentally, libraries operate as a space, right? A space to read and to learn and to be. And how homeless users make use of that space and how the space serves them or does not serve them is quite relevant. On the screen here, we can see some of the aspects raised by respondents. The first is very much echoing what I just said. The third quote recognizes the reality of libraries as space. And the middle one discusses an issue which came up often, and that was the issue of storage for belongings. So as we've discussed, policies which could ostensibly apply to everyone could end up affecting homeless people disproportionately, and rules against excess baggage are one of those. And people suggested lots of solutions for that, including storage lockers. Cronin, that we talked about earlier, he remarked that he doesn't bring a huge bag to the Tate Modern, so why should homeless people be allowed to? And my response to that is, I don't bring a big bag to the Tate Modern either, but I have a house to store it in. So Funding is always a challenge, and we all know that. In fact, a lot of the things we've discussed today kind of boil down to funding, right? Whether funding for libraries or funding for society as a whole. Two of the most common aspects of funding discussed were, first of all, opening hours, and the second, training. Opening hours is a really live issue at the moment. A lot of us are facing cuts to these, and the truth is that being able to be open longer would not only give people jobs and improve the service for everyone, but it would also improve the service for homeless users. And training is also at bottom of funding issue, right? Getting the right people in at the right time to make sure staff are as sure as they can be about how they're serving all their users is absolutely vital. And I don't have a lot of time to go into it, but I do have a whole large section in my book about it. Last but not least is cooperation. I've called cooperation, but really it's working with external groups. So answers in this topic were related to working with non-library organisations in order to better serve our communities. So the fact is, the libraries can be part of the solution here, but we can't be all of it. We can't be. And respondents recognise that. Respondents raised the importance of talking to outside agencies like Citizens Advice, the Homelessness Advice Centre in England, and so on to work with them to help homeless library users. It was one of the most common themes raised, and I think it's a really good place to kind of end this talk for today. Homelessness in libraries is a really vital topic, and there's a lot for us to consider. But one of the things we should take away from today is that we can't do it alone. This is a societal problem, which needs a societal solution. And libraries, as part of society, need to be part of that solution, but they can't be the whole solution. And I think I will end it there and give you 5 minutes for questions. If you have anything you'd like to ask me, you can. If not, I will put my email in the chat, and if you want to get in touch with me later on, you're very welcome to do so.
Brilliant. Thank you so much. That was so interesting. And just to pick up on that quote that you said about not bringing bags to the Tate Modern, I was at the V&A the other week and people were bringing in giant suitcases to check. So you absolutely can bring in giant bags to museums in London. So more of a nonsense point. Okay, we do have a couple of questions in the chat. The first one is, some academic libraries have sleep pods for students. That's a really big trend in academic libraries, having sleep pods for students. And is that something you could see sort of being brought into public libraries?
I'd love to see that brought into public libraries. I think they didn't have that when I was at uni, but I worked for NHS libraries, and we do have a couple in one of our libraries that the junior doctors use when they're working overnight, and I think they're really good things. I mean, there's far less. It's not as much cleanup as you would fear. It's actually quite simple. So yeah, I mean that's also a budget issue, right? But I think yeah, it'd be really, really interesting.
Yeah, they are incredibly expensive. Um, Another question is, are there any future plans to connect with homeless patrons and compare these results of staff with their responses?
Yes, in short. So I'm going to write a follow-up journal article to the book where I'm going to be talking to homeless users of libraries. I'm looking at getting some funding for doing that just now, just because I need to go a little bit about the UK and take some time off. It'll probably be my aim is to be collecting results and writing it towards Christmas time, and then looking at publishing after that, because I've got quite a few things going on for this book at the moment. I'm speaking to the American Library Association, a few other places. But yes, in short, yeah, I'm really eager to do that.
Brilliant. I had a question about when you were doing this research, did you come across any public libraries that you thought were doing really good things with the homeless users, or was it very much just they're just kind of dealing with homeless users rather than doing something
Oh no, on the
independent?
contrary, a lot of people were doing really, really great things. Um, I'm just going to get up a couple of quotes, but the thing that came across for me most in this survey actually was how hard library staff are working to make, and on average, their to make their libraries welcoming for homeless users, and putting in huge amounts of time, huge amounts of their own money, their own effort, and so on. I
Mm.
had people responded in the open questions to say that they had um, people die in their arms of drug overdose and cold. But there was a really nice quote, and I was just opening it there because it's nice to. It's from one of the responses from respondent 67. Um, and this person describes what their library does, and I think it's awesome. So homeless libraries use the library I work at regularly, all day, every day, because there's no other local support. I and the other staff buy food, clothes, tents, blankets, and make food and hot drinks for homeless people. We've experienced times on Saturdays where we've been out scouring the charity shops for warm clothes and blankets for homeless users because there's nothing else to support them in the winter at sub-zero temperatures. Everything we buy is from library staff's own money. And there were quite a few quotes like that that really kind of struck me as um, it's one of those things that shouldn't have to be happening. Um, it's similar to when you learn things about food banks, right? The people that are working in them that are doing so much for them are brilliant, but there shouldn't be such a thing, right? You shouldn't need to have people shouldn't be doing that. And this was similar to that. There were a lot of responses from staff that showed that staff in libraries across the country are really going above and beyond a lot of the time to help people to fill gaps that should be filled by other social services and aren't being filled by those social services, and just cut after cut after cut, you know.
Mm. You mentioned speaking at the ALA conference, and one of the things I think we've heard a fair bit from US public libraries is the debate about whether library staff should be equipped with Narcan to help with drug overdoses, and whether that goes into mission creep. And I know you talked a little bit about what is a library mission and that being very nebulous. So, do you have any thoughts on that in relation to what is happening in public libraries in our country, in the UK?
Yeah, I should just say it's not the conference I'm speaking at. I'm doing a special talk in August for their summer program.
Okay.
Um, but yeah, I mean, I've watched with kind of interest in Arcan discussion. It's been going on for a good 5, 10 years now, on and off, and I'm never really sure where I land on it. Actually, I'm just because it's a medicine, I worry about it. You know, I worry
Mm.
about. I'm not even sure what the legality here is of staff being expected to administer that. I don't know if we'd be allowed to, but um, it that is probably where I would also join people and say maybe that is a bit of a mission creep. It's a great thing to have available, but are staff going to be given enough training? Are they going to be comfortable with administering medication like that? You know, when you do first aid training and you're taught about dealing with heart attacks, you're not even allowed to give people an aspirin. You need to give them the aspirin pack and they can take an aspirin if they want. And then that's kind of coupled with the fact that Narcan really does work, right? It does save lives, objectively. Um, I would probably favor a general societal encouragement for people to carry it more regularly, particularly when they work in public facing jobs rather than it being something expected in a workplace. But I know I've sounded really mealy mouthed about this, but my inclination would be to go with whatever the unions say on this and go with it with that. But yeah, I know that's kind of a non-answer, but yeah, that's my feeling.
That's fine. I think if you think about it in the context of first aid, since you mentioned first aid, it is there are people that are hesitant to give CPR, for example,
Yeah,
and that's a really established life-saving thing. So yeah, I think like you get into the territory of like of Narcan and drug users, people are probably even more hesitant to do that, aren't they? Because they're like, oh, what if, something bad happens? What if they're not a drug user? What if they don't need the Narcan? All of that kind of stuff. So yeah.
yeah. I understand that it's in there if you're not overdosing, it won't do any harm, is my understanding. But it's one of those things where, you know, people worry about this stuff. And even when you're talking about first aid, every first aid course I've been on has been someone worried about, you know, getting sued if they do it wrong, that kind of thing. So
Mm.
people have genuine and real concerns about it. So I would, my inclination would be to defer to kind of workers' unions and workers' groups and see what they think. If you were to ask me whether personally I would carry it, the answer is yeah, I would. But I would not necessarily make someone do it.
Mm. Brilliant. Thank you so much. I don't see any other questions in the chat. Anybody got no? in that case, we will wrap up since we are just about hitting time. So I'm sure you'll all join me in thanking Kevin. That was a brilliant session, really, really interesting. Thank you so much. And yeah, we will see you all in the next session starting in 15 more minutes at 4:15 UK time. And thank you. Thank you again.
No problem.